Right, good afternoon, everyone. Firstly, I just want to apologize for such a late start. As we know, Vincentian timing tends to happen every now and again. But nonetheless, I would like to welcome you to our event, HIV/AIDS, in St. Vincent and the Grenadines panel discussion and Candlelight Vigil. Before we begin, I just want to ask you guys, how are you feeling today? Is anyone brave enough to at least tell us how you are?
I'm wonderful.
Thank you. So we have one wonderful. I love to hear it. All right. All right. So the purpose of today's session is that we're going to be learning and giving some much needed context on HIV/AIDS within St. Vincent and the Grenadines, and we also want to share some important information as well. I'd also like to acknowledge our sponsors for this session, which is UNAIDS, the World Health Organization, and the Astrea Foundation. Now, before, just some small housekeeping matters. I would also like to inform, for those of you who have not collected any trinkets, there are some behind, and at the end of the session, there will be a candlelight vigil. We do have candles provided, so when that happens, we'll be sure to distribute it to everyone. If you need anything, you could just let me know, or our lovely Vice President, Karen Singh, and we'll be sure to help you. And after all the activities are done, we do have snack boxes that will be available, and you're welcome to stay, network, and connect, although we do know it will be a bit late. So allow me to introduce our lovely panel, our lovely panelists. We have Bikini Barrow, Joshua Bardu, Phyllis John Primus, and of course, Winfield Tannis Abbott. I'd just like to hand it over to McKinney so that she could formally introduce the panelists.
Good evening, everyone. My name is Bikini Barrow. I was tasked today with being the moderator for the panel discussion. And I would like to welcome you now formally to this important and timely competition on HIV/AIDS in St. Vincent and the Grenadines, hosted by Equal Rights, Access and Opportunities, Aurora, SVG Inc. Now, on behalf of Aurora SVG Inc., I would like to thank each of you for joining us here in person at the UWI Open Campus and those tuning in via Facebook Live. Your presence here matters because conversations like these are very vital. They are what shifts narratives, opens hearts, and most importantly, challenges outdated information. And it helps mitigate the traps that we have of misinformation in St. Vincent and Grenadines. As you know, Aurora SVG, our job is to educate and bring awareness on numerous topics, especially ones affecting vulnerable population in St. Vincent and Grenadines. And for today, we bring the topic of HIV/AIDS in St. Vincent and Grenadines. Now, our outcome today is focused on sensitizing and educating persons about pride in the independent Anglophone once it comes about in terms of HIV/AIDS, the pride of St. Vincent and Grenadines. But before we get down to the meat of the panel discussion, I would like to further introduce you to our lovely panel. I'm not part of the panel, I'm a moderator for all, and I would like to start off first from the end with Mr. Winfield Tannis Abbott. Now, Mr. Winfield Tannis Abbott is a human rights, HIV/AIDS, LGBTQI+ community and civil society advocate, activist, and he's also part of CARE SVG. He has a strong passion for advocacy and activism work in the field of HIV/AIDS and key population, and is a service-focused individual who is skilled in building community support, key coalitions, and strategic networking partnership. He is a pillar of strength and a strong team player whose vision in HIV/AIDS response is similar to UNAIDS. And not just similar, he's been part of these foundations for many years. So one of his goals is getting to zero goal and ending AIDS by 2030. His vision is realizing zero stigma and discrimination towards persons living with and or affected by HIV/AIDS. Now, we all know Winfield, but just to give a more in-depth of history, Winfield has spent over 30 years working and volunteering in HIV/AIDS throughout. I can't even say St. Vincent and Grenadines, throughout the whole world. when you talk about experience of the reality of HIV/AIDS, you talk about Winfield and it's about in St. Vincent and Grenadines, and for that we are so much. We at Aurora is so much in appreciation of the hard work and the long years of service you had, and we're so happy for you to be on the panel today. And we move over now to Miss Phyllis. Miss Phyllis John Primus. I just wanted to get the name properly. And Miss Phyllis John Primus is an ILO certified industrial relation and human resource development professional with over 26 years of experience. John Primus is from Evesham, a farming community in Marico Valley. She is a wife and mother of 2 awesome boys, daughter, sister, auntie, and friend, and believer in God Almighty. HIV/AIDS activist is Phyllis John Primus, who worked extensively specializing in HIV and AIDS in workplace policy, advocacy, and program implementation. She is widely recognized for promoting safe, inclusive, and non-discriminatory workplaces through evidence-based HIV and AIDS interventions. John Primus served as Executive Director of the St. Vincent's Employers Federation from 2013 to 2023, so that's like 10 years of service, more or less. In this capacity, 26 years was in this capacity, 10 years, where she led the development and implementation of HIV and AIDS workplace policies, education campaigns, and health promotion programs across public and private sector, in collaboration with ILO AIDS, the Ministry of Health, and the Ministry of Labor. She supported the adoption of HIV in workplace policies in over 15 companies, strengthening worker protection, confidentiality, and stigma reduction. Now, when we go and we speak more about how activists in St. Vincent and Grenadines have not just spoke or sat in places of just St. Vincent and Grenadines, we then speak about another person, which is Phyllis Primus. She served as Community Liaison Officer with the Caribbean Vulnerable Communities Coalition under the OECS Reduction Strategy for HIV/AIDS. During her tenure, she coordinated interventions for key population groups, but with 2 stakeholders, the SVG Human Rights Association and Red Ruby Inc., who is a sister of all of us in Aurora. As Community Liaison Officer, she took the task of sensitization of key population groups, vulnerable women, recreational business, and key stakeholder positions to advance HIV/AIDS reduction intervention. A committed community advocate and volunteer, Ms. Primus continues to advance stigma-free communities and organizations, contributing to stronger national and regional responses in HIV and AIDS. Fun fact about her, she is an active member of the Helen's Daughter SVG, a farm-horror group dedicated to development of female farmers, women-led businesses, and she enjoys cooking, gardening, and empowering connections. She is committed to making a difference wherever she is led by using her skills, experiences, and expertise to the holistic development of the people of SVG. And the last person I want to know, I don't think we need to give Joshua a long read-out bio, but for the sake of, transparency, let's go. Mr. Joshua Badun is currently our Director, President of Aurora SVG, and is an award-winning lawyer, activist, and writer, and NGO leader from the Caribbean multi-island state of St. Vincent and the Grenadines. He is the President and Executive Officer of Equal Rights, Access, and Opportunities SVG Inc. He is a human rights organization dedicated to promoting equality and non-discrimination in SVG, with a special focus on women's rights, children's rights, LGBT+ rights, and disability rights. when we go to WAD, we look at service. Service not just to our organization, not just to persons in St. Vincent and Grenadines, but another service provider throughout the Caribbean region. And as we have seen over the last year, he's been going further than just the Caribbean, but very global in terms of expressing the need for protection and educational awareness for vulnerable groups throughout the world, and particularly in St. Vincent and Grenadines. Now, we would like to say Border have put down his legal hat, but we can say that because we continue to give legal aid through our free clinic in collaboration with Red Roots and other of our grant funders. And he pushes the work along with a team of legal professionals to research and compile data on laws concerning sexual and reproductive health rights, including those in relation to HIV/AIDS, in many countries in the Caribbean and for UNFPA. I would like at this moment for us to give our panel a round of applause before we start. Now, I like to make things a little bit exciting because we want to understand from the core what really is HIV/AIDS, or is there a difference between HIV and AIDS for persons who don't know? And I would like to start off this question with the first person on our panel, Winfield. For those who may not know, what exactly is HIV and how is this different from AIDS?
Okay. As we all know, HIV is human immunodeficiency virus. It's a virus that attacks the body immune system. So HIV happens when you have unprotected sex, and it can also happen between a mother transmitting it to a child and it can be abused. HIV can be treated, but there's no cure for HIV. And if you don't do what is necessary once you're HIV positive, like having a positive outlook towards life, eating healthy, taking your medication, you become what we call full-blown AIDS. So you must go, so HIV and AIDS are separate. You get AIDS if you're not being treated, taking your medication, you then go on to becoming AIDS. And HIV by itself does not kill. HIV cannot kill you. What kills you is the opportunistic disease that you may get, like Carini sarcoma, which is a form of cancer, and you get pneumocytosis, which is pneumonia. But when you die, so with HIV, if you die, they will not say you died from HIV. They will say you died from HIV related, because HIV by itself cannot kill you. It has no strength at all. So it is attacked by different viruses to the body that weakens the immune system and attack you, and then you become full-blown AIDS. That is the last stage of HIV.
So what I'm understanding is HIV is the beginning.
Yes.
It's the beginning. It's like how to say, like when we just start to run.
Yes.
It's the beginning.
Yes.
But it's the virus basically. But if we do not treat it,
yes,
mentally, physically, medically, then we then step into AIDS, which is where our body becomes even more compromised.
Yes.
And is vulnerable to attacks, which can result in
Death.
AIDS-related
deaths.
deaths.
Yes.
Okay.
And a person can live up to as long as they want with HIV, and will die, they lead normal life. The person live with HIV for over 25, 30 plus years, and still alive, healthy and well today.
Now having a more understanding for the question of what is HIV and how is it different from AIDS, and just understanding how it really works in our body, I want to go down to Phyllis, and I want to ask you, who are the key populations mainly in St. Vincent and Grenadines was impacted by HIV/AIDS?
Okay, so when we speak about key population, or you might say the acronym KPIs, we're looking at groups that are considered vulnerable or maybe disproportionately affected by the disease. And it may be based on their lifestyle. So to narrow it down, we can look at persons affected by gender-based violence, men who have sex with men, sex workers or those who involve in transsexual sex, injected drug users, transgenders. It may be persons, that we consider vulnerable based on their economic or social background, or livelihood, or there are some communities who may be at risk based on how their position. So for St. Vincent and the Grenadines, these are the key population groups that we would say are considered as key population.
So adding to what Ms. Phyllis just said, she's saying that our St. Vincent key populations are the vulnerable group populations in the country that are more impacted by HIV. Notwithstanding that, persons of different economic background are vulnerable to, but these are the ones that are more open towards based on their economic background or just their vulnerability of not having proper protection and awareness of how they can protect themselves and how they can.
But I can also say as well too that you're finding heterosexual who have been increasing not only in St. Vincent but throughout the OECS and the Caribbean. And I'm speaking that because I used to be the chair for the Caribbean Regional Network of people living and affected by HIV, because what you will find when you come to do an HIV test, we will ask you questions like, are you single, married, and so forth, and then we'll also ask you questions like your sexual orientation, if you are gay, bisexual, or what. And even if you, the person who's doing the test, know that the person is gay, you cannot put that because they will tell you that heterosexual meaning straight. But that heterosexual man might be going and have sex with someone who's gay. So he will not tell us that he's bisexual. And what we are finding is that the rate within the region, because the person who's having, the man who's having sex with man will more protect himself, but the man who's supposed to be heterosexual will have sex with another man, have sex with a woman. So which means in most likely he can pass it or receive it from that man, then pass it on to that woman. So because he's already deemed heterosexual, that's what we will put them at. But when you look at it now, those are the persons who more or less is causing the rise of HIV because of the double standard of their lifestyle.
I want to open another question to the panel. When we speak about HIV/AIDS, within the last couple of months, I would say within the period of 2024-2025, we've heard a narrative that HIV has decreased in St. Vincent and Grenadines. I want to put this to the panel. Do you think that HIV has increased or decreased in St. Vincent and Grenadines in terms of infection rates? And if yes, why?
Okay. I work with the Ministry of Health, and the year before it was about 40 plus, and last year I think it was 36. So that is showing a reduction, and that will come from, we are seeing more people coming to be tested. We are seeing more key population, those who are the MSM, the men who have sex with men, the lesbian, the bisexual. We are seeing them coming to do more tests. So it means that if a gay man who's having sex with another man comes to do a test, most likely he will bring his partner, and also his partner might call other persons who form part of that LGBTQI plus community, and you will see them coming to do tests. There has been a lot of condoms. We are seeing women especially walking with condoms, and it's something I always say to women, if you're going to have sex, walk with your own condom and you put the condom on. It is safer that way. I believe in a woman putting the condom on because you never know what will happen, and a woman will tend to protect that condom and having it in a safer place where the wallet is warm, because she will not use a wallet, she will use a purse. So there's more space within that purse. And there's a lot of education that's been happening. I have gone to all secondary and primary schools, and I believe I went to all churches, I've been to all sporting organizations. The message is out there. Our problem is we use ignorance to say we don't know anything about HIV. And I always promote that you must use a condom. If you can't be faithful and have one sexual partner, the message is out there. I am always talking, I'm practically the face of HIV around the world. So people know, protect yourself. And HIV has been on a reduction in St. Vincent and the Grenadines. For those who come forward to be tested, we don't know those who will go elsewhere and go out of the country to be tested.
Okay, so while there's, we can say that St. Vincent and the Grenadines maintains a relatively low prevalence when it comes to HIV, we are still having new infections. And as such, it still raises the concern of persons being mindful that we are still grappling with this age-old pandemic, that HIV and AIDS is still among us. And from my experience interacting with the population, which are mostly the persons who are open and vulnerable to contracting these diseases, this HIV and even sexually transmitted disease. So while there's a relatively low rate of, for those who we are aware of their status, we have seen an increase in the sexually transmitted infections and diseases, which raise us. I mean, we have to be mindful also that if this is happening, where persons are exposed to contracting STIs or sexually transmitted disease, is that they are not probably educated enough, or are we reaching the population that needs to be sensitized that, listen, it doesn't matter your age, how bright you are, if you don't do what it takes to prevent you from contracting an STI or even expose yourself to HIV/AIDS virus, it means that there is an untapped population that we still need to reach. There are persons that we still need to resensitize, because I can say that there are persons who have been educated a lot about HIV and AIDS, and that I would say when feel. If I compare, say, the last 10 years, I believe that we started the schools, in the primary schools.
We have done all of that. We have been to the kid as low as the kindergarten.
Yes.
Every school in St. Vincent, from kindergarten come right up, would have had the knowledge of HIV, demonstration done to them. Every carnival show, we have been to all the nightclubs, those places where they say they have the prostitution. We have touched practically the fabric of society in relation coming to HIV.
Yeah.
Yes.
And I want to also note that, as I would say, persons, I wouldn't put it down to say key population, but once you're having sex, actively having sex, I mean, sometimes HIV is such a sexy topic that we don't want to talk about it, and we may not be comfortable speaking about it because it's a personal interaction of persons having an intercourse, and sometimes people shy away from it, or feel like you're up in my zone. But we need to have that conversation. We need to continue to put it on the table, to remind persons you have a responsibility to protect yourself. You also have a responsibility to empower your partner, your friends, your community, the classroom, everywhere you go. We all have a responsibility, and it's up to you to put that responsibility. Would you put it in the hands of someone else who you may not trust with your own health and wellness?
Sorry about that. I thought before you went further, and one of the things we try to do is to talk about the other diseases that where there's no cure, like the herpes and so forth, because it doesn't make sense, because people think unprotected sex and leading to AIDS, that's the only thing you can have. But you have the herpes and all these different diseases that has no cure, and we try our very best to talk about those other diseases and infections to let people know anything that is unprotected sex, where blood is going to, semen is going to be semen and it's unprotected, not only HIV, but you can come down with other diseases as well.
Right. And to just pick up from that, now we're talking about not just HIV and AIDS, but the fact of being exposed to other STD, STI. I want to ask a question about treatments for HIV/AIDS. What are some of the treatments available for HIV/AIDS and in St. Vincent and Grenadines, and how you can actually access the treatment?
Okay. HIV/AIDS treatments are free. Once you have a communicable disease, all medical is free once you go to the government hospital or clinic. And so now, I think now they're giving what we call the 1 a day. So HIV has gone from the 7 and 8 pills to now you can have what you call 1 a day. St. Vincent has not yet introduced where you can do the injectable for up to 6 months or a year. Those are very costly, but other countries are doing that. And we only have one central area. Well, right now they're in the process of looking to bring HIV into primary health care, where it will be decentralized in different areas. So you go to the clinic, which is at the hospital in the outpatient clinic, and the doctor there who's in charge of HIV will prescribe your medication, and then you will go upstairs to the pharmacy to get your medication. You can get your medication for up to 3 months to 6 months. So which means they will see how the medication is working with you. You will start from a line 1, you have the line 2, you have the line 3, meaning if medication doesn't work, if your body is rejecting, you can go to something else. And I think the medication maybe they use now, I know they can use Truvada, which is a 1 a day pill. So medication is free. And one of the things we always say to people, once you have your medication, you must eat properly to take for the medication, the ARV antiretroviral drug, for it to work effectively. You must eat, and you don't have to eat this big set of food. You don't have to eat cheese and ham and egg. Just make sure you eat something so that you can digest, because they say once medication goes into your body, if you don't eat anything, the medication eats what is inside of the body. So you must eat something, and it's preferable to take your tablet with water, because I understand that milk is not good to take tablets with, so take your tablets with water. And if it's once a day, do your exercises, it's one place you go.
This is such an amazing opportunity or strategy when addressing HIV and AIDS in St. Vincent. If you compare, say, in the 1990s, there were a number of hospitals, once they became infected with HIV, they died quick. Whether stress, and because we didn't have access to the medication. And so that's a huge improvement. I have been working with persons infected with HIV, and they were persons who would have gone along with me when we were doing the workplace programs in order to give that education to other persons, to let them know how I feel living with the disease. And they're no longer with us. But fast forward to say 10, 20 years, and that treatment was available as it is now. Well, we know globally the trends have changed where the access and the improvement to medicine is also remarkably tremendous, right? And so where persons had that fear of dying from HIV, if they do the right thing in terms of accessing that care and treatment that is available to them, they are able to live normal, healthier lives, right? And you know, it's amazing. I sit here and I reflect, on those past, and sometimes they were up, and sometimes in a matter of days, they would be so sick that they can't get out of bed.
HIV is now a chronic disease.
It is labeled as that now.
Yes, that's what it is now. It's no longer a killing. It's no longer described as the disease that as soon as you get it, you die.
Right.
We have seen people living way longer and living better, healthier lives than persons who are not HIV due to science and advancement.
Right.
Because of the advancement of the treatment and care that is available. But on the other hand, I want to note that while in St. Vincent and the Grenadines, we have come thus far, and yet there are persons who have the fear of accessing such care and treatment. There are persons who would have been tested positive. And if you look at the statistics, the number of persons tested positive for HIV, and you compare it to those who are accessing the treatment, it's not balancing.
No,
It's
but
actually less. So it means, Winfield, that there are persons who are infected with HIV, and for some reason or the other, they are not accessing this free care, treatment, and support that is available.
let me make a correction there.
And that is the reality.
No, but let me make
of
a
our
correction there,
situation here in
Phyllis.
St. Vincent.
What is happening right now is test, treat. That's how HIV has become now. So once you're positive, you're treated at the same time. And that is a recommendation by World Organization. No, it's no longer long ago when you were tested positive, you waited before you get your medication. If you're tested positive at 9 o'clock, you're being treated. So it is what we call test and treat. It simply means everybody is put on treatment. The question that has been asked, will everybody take and access the treatment? But everybody, once you're tested and you have been tested positive in St. Vincent and the Grenadines and elsewhere in the Caribbean, it is now test and treat. The onus is upon the individual, because once you do the counsel, we do what we call pre and post counseling. We will explain to you what is happening, what will happen if you don't take your medication, and if you don't take your medication as prescribed and on time. So that onus is on the individual after tested positive, realizing he's positive. This is the medication, this is where you go to access your treatment, and if you don't go, as I always say to them, it's no fault of the Ministry of Health or the government of St. Vincent and the Grenadines. It is the fault of the person, because medication is free, and also once you're positive, there's food that is being given from the department that I work. It is not much, but at the end of the day, it helps in bringing that balance. If it, for example, if it is a mother who's pregnant and she can't get anything to eat or give milk to the child, that is also provided for a mother who's HIV positive, where milk and so will be provided so that she does not breastfeed that child.
Right. I think what we're gathering here, the situation of being unbalanced is not that there is a problem with access. There is no problem with access. There is a problem with persons going take it up on themselves. Yes, I'm HIV positive now and I need to go at the hospital or at the pharmacy to get my medication. I think that when we look at that, that is not, we can't say that the government is just doing their responsibility. Their responsibility in that space. We have to think about the stigma.
In that place where they go.
The stigma, the discrimination, the fear of my status coming out contribute to the fact that there are not much the balance of data. It's not where it needs to be right now.
Yeah, but Mikini, I can also say to you that yes, stigma and discrimination for me has lessened drastically. It has led, and there's proof and there's data that supports that. What has been happening, we have seen a lot of self-discrimination that is happening with people living with HIV. So for example, you might be walking on the road and you might see you might know the person who's HIV positive, but they're seeing you talking to somebody and you may glance over and look at them and they have the opinion that you're telling that person that they're HIV positive. Self-stigma is a big problem. And I always say, and I will say it again, we use a lot of ignorance. We use ignorance to not wanting to know and to do better.
Go ahead.
Well, I agree somewhat with Winfield when it comes to stigmatization. We have to look at other factors that contribute to the individual. And let's narrow it down for us to think. A person has just been tested positive for HIV. That person has to process their new status, right? That person also have to think about whether or not they will disclose their status to the partner. Winfield also just mentioned prior that there are heterosexual relationships where partners cross the line. When I say cross the line, mean that they have more than one sexual partner, or not just having sex with their female or male spouse, but they will go to other men to have sex with men, or other women to have sex with women. And let's say that this heterosexual contracting HIV in the extra that extra relationship he or she does not want to disclose, right? And so we're dealing with, I'm saying all this to say that the other contributing factors that has nothing to do with the access often contributes the person who's not accessing. So I wouldn't want to disclose to my spouse, and I shouldn't put in I in it. But let's say that person may not want to disclose to the spouse, and so they go around trying to live and live normal lives without disclosing or taking the responsibility to inform that other person who would be affected or impacted by their status. And they don't say anything. True. And then another thing that we must also be mindful of, that we have become a sexual nation, like I've been saying, a more sexier nation. We are now open up to a lot of not just the promiscuous, but we have an open village now. We have the global market when people, when I say market, you have your phone, you have the connections. There are persons who want to try on certain things. Mm-hmm. There are persons who are now introducing sex toys and things of that sort. And they will say, well, I am not having
that's an individual.
Yes, it is.
That's an individual thing, Phyllis.
It is one of the factors.
Phyllis, we have to be with our health. Our health is our health is your responsibility.
Our health is our responsibility.
You as an individual must, because if I'm hearing a young lady is HIV positive. And everybody is saying, they know that I like this young lady. And they're saying our relationship is getting closer. And they're saying, Winfield, she's HIV positive. Nothing is wrong in having a relationship with her, but make sure you use a condom and make sure you're always protected. Okay. And I may say, you know what, let me go and prove for myself. Whose responsibility is that? If I become HIV positive, it is my responsibility as an individual. And sometimes, as I always say, we have to let people need to know. Because there's a wrong and there's a right. If you love yourself, you have to take that responsibility on yourself to do what is right. And that is why when we do the pre and the post test, and when you're positive, we will ask the person, do you want to share with your partner your result? And we usually tell people, you need to have some young girls to come and do the HIV test and take a photo with the result and send their partner. And I usually ask them, when he took it, did he send his picture for you? You have to be responsible because it is you as an individual.
I think what to cut so we can get on to the next question. I think what Phyllis is alluding to is the fact that yes, it's a social responsibility of you as an individual once you're tested positive for HIV. But there's also contributing factors that have created such a wide and reckless behavior of individuals when it comes to spreading of HIV.
But people say they rather have HIV than cancer. That's the talk now, that is a wrong.
Yeah, but we want to create a space where we are saying that we understand, yes, it's the responsibility of the individual, but these are other factors that lead to reckless behavior. The advent of technology have allowed persons to see, not even persons, but parents, the next question. The advent of technology has allowed persons to see and be and have access
but there's nothing we
to
can do.
their curiosity or towards them being curious, and have brought in different behavior in their relationships, where it now becomes not so conventional. And even though we don't want it so conventional, but it's not the stereotypical relationships anymore in terms of sexual behavior. This don't mean in terms of what population you are from, but it means in terms of the nature of sex that we are now doing and being aware of. I think that is what Phyllis is coming from.
Exactly.
Yes, it's our responsibility when we know we have HIV that we should tell our partners and take our medication. But it's also the responsibility of the government and the citizens to ensure that persons feel comfortable, and so there are still persons, still human beings, and still have human rights, and we should be able to go and get tested, or we should be able to go and access medication without feeling anyway. And that comes from the pharmacist who gives us the medication for them look at us. Might trigger us feeling being starting to self-stigmatize ourselves. It might not say nothing, but the body language might make us feel uncomfortable. Sometimes we don't have to say anything, just the way how we look at people, because we know intention. We had a thing that said, we do those things. And if I, God forbid, if I'm HIV positive, and I'm here, and two persons talking, and the person look wrong and say so. I guess we didn't talking about you can't, because we know our body language, and our body language contributes to persons feeling a type of way. Whether we say, okay, we are following the mandates that you have worked so hard in the government service and the public sector to provide, but our body language still makes the person who is HIV or AIDS positive
And that should not
be
be.
a kind of way. And that's why
And that should not be at all. It should not be at all.
It should not be, but
It should not be.
the reality is that
It should not be.
these things happen, and these are the contributing factors that hinders or establish barriers to access to care and treatment. I want to just raise a quick case on point, and I am happy that you mentioned that future soon, they will be looking at decentralizing treatment. Decentralizing treatment, which I believe will be really excellent once it is managed, right? I have had clients, because they could not, and you may say, well, you tell me they can't afford to come into Kingston. They could not find the money to pay to come to Kingston to access care and treatment. I'm telling you.
Well, I can put a stop there
right?
to you.
Hold on.
And I'll put a stop there to you as well.
You will respond, and you know, often, and I would like, being an HIV activist, we have to be conscious of our realities, and at the same time, if we want to make the appropriate intervention, we have to accept the realities. We cannot live in our life in a zone where we're saying, but that is so it shouldn't, if it's, you know, the what ifs and make assumptions. We need to look at the reality of the situation. Look at the reality of this client. I'm saying to you that this client, who is in need of the care and the treatment, is telling me that she or he cannot access because they didn't have the money to pay to go downtown. And then I give that person the money from my pocket, and they went for the treatment, and they called me. Sometimes we don't know what these people are facing.
Listen.
We do not know what they are facing. And sometimes, and that's why I say, as a community liaison officer, it means that working with the population, it's not just the ordinary kind, you know, that will have no problem jumping on a bus and going straight to the clinic. You're looking at key population who are stigmatized because of their nature, their behavior, maybe those who are transgender, those who are labeled, or them they are, you know, scattered, for want of a better word. I'm not using that. Just for us to come to the reality that these persons, they are already stigmatized, and sometimes they go through rough times. They're not the ordinary who can just come and do whatever. They are persons who, because of their very nature, lacks the motivation, lacks the finance to access certain treatment that is available to them. It's not saying that the treatment is not there for them. I'm not saying that. I'm just saying in their own state, there are other issues that hinder them from access. And that is the reality.
I have been, and I know the reality of people living with HIV. And I know they're also good at exploiting people. I know that as and for a fact. And I've not only dealt with HIV and symptoms, and I am not talking by the wingsy. I've been doing this since I was 18, throughout the whole card, and I know about them. And I know how people live with HIV sometimes, they feel entitled. I can tell you that. I am walking there, I am seeing it, I am dealing with it. They feel entitled. And the same set of people who come for you for money because they can't get access is the same set you're going to see in Kingston walking up and down every day. So how are they getting from Kingston, from their home to go Kingston, but to go and get their medication, they can't go to find it where it is free. I have seen manipulation, I have seen and heard the lies, I have seen how they feel entitled. HIV is a passion for me. We have an organization called Care SVG. When we have funded, we will deal that. They feel that when they come, if Care SVG has funding to give to them, all of the money must go to them, not knowing and understanding what the funder is looking for and want. I have seen all of that happen. I've seen it in my lifetime. And if there's one thing they can't do, and I always say to them, my passion is for people living with HIV. Whether I get paid yes or no, I will do it. But the lies and the manipulation is what I'm having a serious problem with.
I want to move on to the next question. Yes, I want to move on to the next question. But I also want to say is that sometimes when we in our field, and it happens to me also when I my previous job before this, what I have. Sometimes when we in the field, we become so, not just passionate, we become one with the field so much that when people negatively or takes advantage of the hard work that you are putting in and what you see your peers are putting in, we tend to tight-fist it in a sense, in terms of being so cautious with everyone who comes for that support or who we discuss or deal with that support. So we have to be sometimes careful in not, I'm not saying that you're judging everyone, but have to be careful of the anomalies who try to manipulate the system.
Yes.
Looking at it as everyone is manipulating the system, rather than these are anomalies that happen in the system, and we have to be aware of it. And don't let those anomalies that happen in the system contradict or prevent you from helping persons who might really need it. Because if we look at, we always think about vulnerable population, that, oh, there's public service, there's public assistance, there's this. But what we do forget is that you are not living their reality. I think that's what people forget. You sometimes speak out of our eyes of privilege, our own privilege, or the privilege that we walk around and see. Your reality is not my reality. I might have 4 or 5 children, or I might have an addiction that I'm fighting, and on that day I don't have, or my kid has to do something and I don't have the money to go to town to go and access that HIV/AIDS. I remember having acquaintance told me that they used to have to go. They didn't have HIV/AIDS, but they used to be the one going to collect the medication for their friend. You understand? So sometimes we have to be, when we in these fields that we are so passionate about, we have to try to make the bad anomalies not damper and die our passion that we have in service to our passions, right? And our field. But that's a lot of talking. Let's go back over to the panel. And I want to give our lawyer here some time, because we really need to go into the legal aspect of HIV/AIDS here. And we know the age of consent in St. Vincent and Grenadines is 15 years old. Yet children may not have access to the services that we just spoke about when it comes to treatment. And we know that when we talk about statistics for HIV, it's not just sexually transmitted, sometimes it's mother to child. So Joshua, I'm bringing this question to you. The age of consent is 15 years or old, yet children may not have access to certain medical service by themselves. So tell me how the legal system works with this, from your legal perspective. How does this work for us?
Thank you, Makini, for your question. Thank you everyone for joining us in person and those who are watching online or who will watch later. As Makini said, the age of consent here in St. Vincent, sexual consent is 15 years old. Now when we talk about the age of consent, based on our criminal code, the age of 15 years old applies to girls. So explicitly when we read the criminal code, we can see that the age of consent for girls is 15 years old. However, in our criminal code, there is no explicit age of consent for boys or men. However, we have another act in the country called the Marriage Act. And based on the Marriage Act, a girl can get married currently at 15 years old. And also, a boy can get married around 16 years old here in St. Vincent. And so, even if there is an explicit age of consent for girls or females within St. Vincent Grenadines, there's no such explicit age for boys, but from the Marriage Act, we imply that the age of consent for boys is 16 years old. Because, when people get married, they have to what? Or they usually do what? They have sex, okay? So there's an explicit age of consent for girls, which is 15, and for boys, we imply it to be 16 years old. Now, we have an interesting situation in this country. that even though you can have sex at a certain age, you might not be able to go and get treated by yourself or tested or get certain things like condoms or whatever to protect yourself, even though you're having sex. So, even though the age of consent for these girls is 15 years old, we see that they can't access medical services by themselves. They need parental consent or a guardian to accompany them in order to gain access to testing, treatment, and various types of medical services surrounding HIV or STIs in general, which is strange. Because you only love for have sex, you only love for get pregnant, you only love for get married, but you can't go to the doctor and get tested or get treatment. Does that make sense? It doesn't. So we have a situation here whereby in St. Louis and Grenadines, once you're under 16 years old, you have to get parental
consent.
Consent. But if you're 16 years old and over, you can go to the doctor by yourself and do certain things without necessarily getting parental consent. And that's basically what the state of the law is here in St. Louis when it comes to sexual consent. So we see that is something that needs to be revised, because it doesn't make sense that we tell children, because when you're 15, you're basically a child or teenager, you're still a minor, according to our law, because the age of majority when you become an adult is 18 years old, according to our Age of Majority Act. So we need to align some of these ages that we have to really make sense to the realities and what's really happening. And even though, the age of consent is 15 years old for girls and 16 for boys implied, we know that people are having sex much younger than that.
Exactly. Exactly.
Children and teenagers are having sex much younger than that. So, we need to, look at our laws and, see, if this needs to be revised, updated, changed, the age needs to be raised or lowered. So we need to have that discussion and have some legal reform in the country. Because it doesn't make sense that you can have sex and get pregnant, but you can't go to a doctor by yourself and get treatment or tested. Yes.
And thank you, Joshua. I want to put a little sauce in this kind of discussion, right? So, some people are behind sex now. All who are sexually active or being sexually active, we like to say, like, you feel better with what we can. And also, we know the situation where, you might have a social responsibility to get tested. But where is your partner's test results? Right? I want to ask Winfield and Phyllis this question. What should persons do if they or their partner doesn't want to use a condom?
Okay. For me, I always said, not even with married relationship, because and I always tell a wife or husband, do you know what your husband is doing? And don't come and swear, oh, it's one man I have, it's one husband we married, but do you know where he was when he came in at 3, 4 o'clock in the morning? I always say to them, even with persons, if both partners are HIV positive, I always say to them, still use a condom. You must use a condom still. And I also tell them, because you can be reinfected more than once. A person living with HIV can be reinfected more than once. So I always tell them, still use a condom. If two of them say they don't want to use a condom, my advice, if you trust each other and you are sure that you only have one sexual partner, which is him, and you only have one sexual partner, which is her, it's all fine. At the end of the day, there's nothing more we can do as individuals. It is up to a husband and wife. But I will also ask, do you know what each of you doing? And it's sort of thing question, and then they will want to say, oh, what kind of advice you gave him? But what more can one say?
Sometimes you have to just lay above it.
Yeah, just leave it silent. I don't know what Phyllis will have to say about that.
I agree with you, and I'll add some more sauce and probably pepper to the
This is plenty sauce.
to it. Love is a powerful thing. shouldn't be so much in love that we are blinded by the truth, and to understand that, you know, as perfect as relationships may seem, sometimes there's the unexpected twists and turns
Yes.
that could throw us off emotionally. Not true?
Mhm.
And, you know, as a wife, sometimes I say I have to keep myself up to date and to ensure that I am performing my duties at maximum.
I didn't hear that.
Because I'm not going to pretend, you know, that
Keep it tight.
sometimes the competition out there is so tempting and so real, you don't have to go look for it. And so
Sometimes.
it comes back. If you don't trust or you feel something, let me tell you something. God has made us such a special way that this inner voice speaks to you from within your core. It's called your intuition. Why are you watching me like that? Okay, let me speak to the online people. We have our intuition. We will say to you, listen, don't do
That
it.
is true.
Don't do it.
That's true.
And sometimes we ignore that voice of caution within us. So if you are in a relationship, it is important. I've had my tests. I'm not saying that I don't trust my partner or my spouse, but it is my responsibility to know where I am. So too is his responsibility to know where he is sexually in terms of your HIV status. If you are unsure, you love me so much, let's do this thing together. Let's take the test, you take the test. Now, a good thing is, if you have, because some persons would have contracted an STI infection, it is possible from a previous relationship that has nothing to do with the current one, right? And they may expose this new partner to that untreated STI. Now, if you would have tested prior to having that sexual encounter, you would have been able to get the treatment or the necessary intervention there. Okay? So then there's no need for you to reinfect or even pass it on, because it will be done to it. Another thing in relationships, you have to hold your partner accountable. You can't come in and I giving you all them sauce and pepper and honey, and all you want to do is just cause pain. It can't be like that. We have to learn to take responsibility as boyfriend, as girlfriend, as spouse, husband, wife, even the side chick. You have a responsibility to protect yourself, to protect the husband because you know it's not yours, to protect the wife that is not yours, who is going home to a partner and pretending. You have a responsibility to ensure that you don't put yourself at risk, because you cannot pretend that there are these relationships are non-existent in our society. So I would say it is your individual right to know your status. Testing is important because sometimes you have this fear of the unknown because you don't know if you are exposed. And so you will be acting a certain way. But if you go and you get tested and you get your negative result, you will be able to do everything that it takes to keep that result negative. If you tested positive, whether for an STI or HIV, you will be able to get the necessary intervention and live a normal life. You'll be able to cure those curable STIs and go on living a healthy and more cautious sex life. Those who are using the little rose and yes, I wanted somebody else to say it for me. You too have a responsibility to ensure that in the exchange of that with the partner,
Use your own tools.
use your
Yes.
own tools because you
Yes.
don't know if
Yeah.
that partner has an infection
Yes.
or is HIV positive, and
Yes.
then you will be putting yourself at risk. Let's look at this. You take the nice little rose. I have not experienced it yet. And you put it through the other partner. Okay? Sometimes we have to go real raw, as we would say.
Oh yes. Oh
So
yes.
that people can understand. You take the rose and you put it to, you pressurize the partner. Okay? You're not aware of the partner's status, if the partner had any infection and so on. And then that same rose now, without sterilize and wash it, the partner now takes it and put it over to the next partner. So you're transmitting right there.
Yes.
So the risk, as simple as it may sound, and sometimes we don't think about it when we are actually in the pleasure zone. You understand that things go out the window, especially if it is so good.
You're
Some
well
people say
posted.
that it is that good that it knocks your senses out.
I do those already.
I did say I didn't try it.
Yes.
Yes. So, we don't make any assumptions and trust my honesty. But these are the things that we need to sometimes get down to the ground to say,
Yeah.
listen, what is the risk in this for me? Should I take this action or not? Because in the middle of the thing, Joshua, you're going to take the rose there and go and sanitize and wash and
We
take.
take one little water.
However, you understand? And put the gel.
I will know what that
So it's the awareness. I'm asking you to come in with the awareness. Because when we're speaking, we must, to give the reality of true picture. I know online audience probably have a graphic picture of what I'm saying already.
Yeah.
But I'm just saying that to say, these are the risks involved when you're having sex.
Yes, and
Okay.
very high risk as
Yeah.
And high risk, and so you have to be mindful. If you cannot say a definite yes, do what it takes. Take the test, take your partner. Love is not blind. You love me that man, you will do it freely so that we can live healthy and more sexy.
I think two things I want to add to that is, I do what we call female woman examination every year, right? And which is a full examination of my body.
Okay.
Just so that, and it comes, I do it at Health Solutions, right? And it comes with all, I do it at, there's other gyno who does this, that checks your body, checks your organs, depends on your body might have different tests, but part of it is doing a full STI scan. Because every time around my blood, I don't know why I do it, it puts me through a whole stress, whether I use condom or whether the whole life or not, it stresses me out, right? But it's so gratifying after my blood when you get the test result. It pays me when I pay for it, but when you get the result, you feel so
relief, happy.
Wait, this is my status
Yes.
or what's not. I remember doing the one that I did this year. I remember the doctor telling me, they would like women to understand that giving a man a blowjob and putting on a condom after high sex is still making yourself vulnerable.
Yes.
Because sometimes you feel like, oh, we give a blowjob and we put on a condom, we have sex, or even before we have sex, we allow the man to use his penis and not the dough before he put on the condom, right? And that's a risk too. Yeah. So I think sometimes we don't understand. We are aware of the information of you should put on a condom to protect yourself, but we don't understand the things that lead up to the putting on protection can also make yourself very vulnerable. And the other thing I wanted to add to that is that we as persons, it's not one of the greatest things I remember. I don't always call it, but it's taughty, what you need to do is that when you decide to have a new partner, you and your partner go together.
Yes.
I don't fall to the T, but I fall to the T the man and my partner does a test, right? And I get the results. But what I'm saying is that we sometimes need to, and all the time should go with the partner to do test together.
Something I strongly
and
recommend.
receive
That's
the
why,
test
yes.
results
Together.
together.
I strongly recommend that.
The reason why I'm saying this, and if your partner is hesitant towards
Something is wrong.
towards you receiving the test or going with, that is your gut, that is the universe telling you, you know what, you might need to take it back a little slow with this partner. Right? Not saying that the partner is guilty of it because the partner might be working or, do I want to make this information, available for this person just in case I get a shock of my life. Right? But if you're not there with a partner, then you shouldn't be putting yourself there. I think you should always make it, a priority for you and the person to go get tested. And the best way is both of you go get tested and both of you go and get the results.
Yes.
If you're not there with the partner, then don't have sex until you get a result, and you could then say, okay, I'm good with giving you the results of my test for you to see, and we could take it from there. I think we always, and this happens a lot for women, we always like to go by words of our partner. Oh, I just test all the time.
Yes. And he
I
never was
never
that.
get
Yes.
to the STI
Yes.
in life
Yes.
until you go. And when we believe that, when we do our test and God forbid you get a STI or STD, they are the first one, and it happens to both men and females, but I could only say because I'm a female. They are the first one to say, you get a problem.
Yes.
Or they tell you, you are the promiscuous one. So then you're left with, who did this? And the person who actually gave you could be just the said partner, who say that they have never. And one of the things why I said to go and exchange results is that people are so good with technology. People are so good with technology and changing results, information, and all kind of stuff. But this brings me into the next question, right? Where we go into the treatment or the precautionary measures when it comes to contracting HIV, which is PEP and PrEP. Because taking these medications, we know, reduces the level of HIV, well, not reduces, prevents HIV, but there's also the medication that reduces the level of HIV in the system, right? That could make your test show up
Undetectable. Where you have a very low viral load.
Right. So I want to take the question to Winfield and Phyllis. Which one wants to go first? It's fine. What is PEP and what is PrEP? And are these two medications available in St. Vincent and Grenadines? And if so, where can people access it?
PEP is post-exposure prophylactic, and PrEP is pre-exposure prophylactic. One is taken before, one is taken after. The PEP is taken after if there's an assault or anything of that sort. But PEP was mainly for, let us say, persons working in the hospital and so forth, if something would have happened with fluid and so. And also if there's a rape and that person is of the opinion to be sure that the person who would have raped her is not HIV. And it has to be taken 72 hours after because there's a potential HIV exposure. So PEP is taken after. That we have in St. Vincent. PrEP, the government doesn't have PrEP. And I must tell you, PrEP is very expensive, very costly. So they were looking to do it like what we have the OECS. I sit on the OECS RCM that deals with HIV. So where the 5 countries of the OECS come together, so when they purchase PrEP, it is purchased where it can be distributed to those countries who falls under that. They are looking into it. It should be in St. Vincent very soon. But I understand there's a doctor here who sells it at our clinic. It is sold there, but PrEP has to be taken before, but the doctor must prescribe it for you. If you're HIV positive, you cannot take PrEP because you already have the virus. It is for someone with a negative result, they can take the PrEP. So you have PrEP, which is post-exposure prophylaxis, and you have it's HIV prevention. For 28 days, you will take that after you think you're exposed, and you have PrEP, which is pre-exposure prophylaxis, and it is a pill or shot. But in St. Vincent, I think it would be the pill that we'll get, because the shots can be very costly, very expensive. Yes.
I want to ask Phyllis a question on what he just said. Now, we know we have heard about PEP and PrEP for a while. Do you think that these medication has contributed to the rise of other STD, STIs in St. Vincent? With promiscuous behavior of it?
Well, we can't say that.
We can't say because it's not yet.
We're not using it yet.
Only PEP.
Maybe the knowledge of what it can do. But PrEP, as important or effective as it is, it relates to the reducing the risk of exposure. In that, let's say someone is going to have sex, and they must take this PrEP, which is the tablets, at least within an 8-hour period.
Yeah, but it must come from a doctor prescribed, because you're going to tell the doctor more or less that you are sexually active, and there's a possibility that you may have sex with more than one person, and one has to be very. PrEP has done quite a lot in terms of radio saying, because it was really meant for those sex workers, because you also have PrEP for female as well, and for men who have sex with men. And what we have noticed around the world, that it has worked well, because the education must be strong, because it must be prescribed by a doctor, it must be taken according to what the doctor says, and not your own whim. So whosoever wants it gets here, that is what will be done and how it will be done. We have started some session with PrEP. We have done quite a lot of sessions when we go out. Well, I would have done quite a lot of them, and I would have done it where I have the charts and have them go through what is and so forth. I am looking forward for PrEP coming to St. Vincent. I have a positive light to it. I was part of the pilot project in Barbados, so I fully well have an understanding of PrEP, and I'm really looking forward to it, because it's not something you can just go and buy over the counter.
You have to be assessed. And one thing to note, remember PrEP, what it actually does, it stops the body or the immune system from replicating the virus, which is the HIV virus.
But you must use a condom, and we advise you that you use a condom if you're taking PrEP as well.
Yes, because it does not protect you from other diseases, pregnancy or STIs. So there are the pros and the cons of it, but
the education has to be real. Yes, at the
you have to sensitize the population, because you have to be consistent as well. You can't take it and then you figure that you're covered for the period. You have to be knowledgeable about it. Same too as condom. You will be amazed that there are persons who still put on a condom on the wrong side.
Imagine the sizes, a certain size of
there are a lot of people still don't know how to put a condom on.
In the correct.
Exactly. And they don't know how to remove that condom either.
So there's still the space for continuous, I would say, sensitization of the population, to be, always bringing the awareness, building the awareness, and also having that conversation.
Yes.
Make HIV conversation a part of your family gatherings, a part of that gathering when you have, your group.
Remember, sex was a taboo,
and all of that.
And sex is still a taboo that some families don't like to talk about sex, and especially when a child Because I know of a young girl who told her mother that she's bleeding. But the mother would have had her at a very young age and they don't understand. So she started telling the girl, oh, it's sex you're having, you know, but it's not even that. And the mother did not know to explain or tell the girl what has to be done. What she needs to do in preparation of all of this. And that is something, when, especially with young girls, when they start having their menstruation, we need to, and I always say, a mother is the fittest person or female to talk to someone young, because sometimes the men may talk to that girl and because of, may say something different, thinking that, oh, it's time for now for you to have sex, because that has been happening when men get false information, wrong information.
That's a heavy one, I should say, in terms of sexual information, but I would like to think that in terms of education and schools, you know, I have a 14-year-old, and, you know, she have had numerous classes as she progressed through primary and secondary school that deals with, you know, when a young lady first gets her period. Also, I know when she was in Form 3, it was my eye-opening. I had to help her along with different STIs.
Right.
Even though I have one-on-one conversations with her, not always,
Very
you
good.
know, the in-depth in how far they were, you know, dealing with those STI
Yes.
was different from my time.
Yes.
So, like,
Exactly.
you know, some households, sometimes we can't help that our parents did not get access of information or have the understanding of how to take things that they have lived, that is part of their body, to be able to teach their kids and their grandchildren how to be able to accept that. And that's where the school and secondary socialization comes in as a responsibility now to take that child under that care, to give that child that explanation of to, this is happening to your body. This don't mean nothing is wrong with your body. It just means that this is part of life and this is what you do, A, B, C. You know, so it's not always on the onus of the parents or the persons who live in the household to be the person to share that conversation of your body changing or the conversation of sexual exposure. But it is our responsibility to be there and give them a space of comfort if they need to have the
That's
conversation
true.
with us.
Yes, you're correct.
At this point, you know, as we talked about unprotected sex and, you know, if it feels good and prep, I want to take a question to Joshua. And this is something that I feel passionate about. Some people know, as I say, some persons know they have HIV, and they still have unprotected sex with others. It's a Vincent Greggy. Is it a crime to intentionally infect someone with HIV/AIDS in STG? And if it's a crime, how do you prove that that person intentionally? What did law look for if they want to prove that that person intentionally spread HIV to the person?
Thank you for your question, Makini. So, in St. Vincent and the Grenadines, let me start by laying out that we do not have any laws that explicitly criminalize HIV non-disclosure, exposure, and or transmission within St. Vincent and Grenadines. So we don't have any explicit law that you could go look up and say, if you give somebody HIV intentionally, that's a crime. However, we have other general laws and provisions that can apply within the situation of HIV. For instance, under the criminal code, we have various assault provisions that could be used if somebody, per se, intentionally gives somebody to transmit HIV to someone. So the provision doesn't say if you give somebody HIV, that's a crime. But based on the interpretation of the assault provisions in this country, you could be held liable if you know you have HIV and you intentionally infect or transmit it to someone else. Also, we also have another provision in Section 291 under the Criminal Code that talks about if you spread an infectious disease to somebody. It doesn't say again HIV because that could include a number of different diseases or viruses, but that's a possible provision that could possibly be used in sentencing and guarantees. Yes, that's the assault provision. Previous bodily harm is one of the assault provisions under the criminal code.
Okay.
Yes, the same assault to simplify it for the audience.
Okay.
But yeah, so that is how the law is in SPG. So we don't have a law that explicitly says if you don't disclose, if you expose someone, if you transmit it intentionally, that's a crime. But under different laws, based on legal interpretation and what the case law has said, if you intentionally, if you know you have it and you intentionally give somebody it, then that can be a crime here in St. Vincent and the Grenadines. Now, what we also have within the legal system is HIV can become an aggravating factor, meaning it can result in you having a harsher sentence or punishment if you intentionally transmit HIV. So, while we don't have laws explicitly again that have been passed by our parliament, we have a new government which has see if anything happens or not with this present administration. But while we don't have explicit laws here, we have what we call sentencing guidelines from the Eastern Caribbean Supreme Court. For instance, they have sentencing guidelines. They have sentencing guidelines when it comes to sexual offenses. So if by chance you know that you have HIV, for example, and you intentionally transmit it to somebody or you expose someone to it, and for instance you rape them and so forth, then that could be an aggravating factor which will result in you having whether it's a higher sentence in prison or a higher fine or whatever the punishment is that the court gives out to the specific offender. So it can become an aggravating factor, and also under our Trafficking in Persons Act, it's also an aggravating factor because there's sex trafficking and so forth. And so it can result in those persons who engage in that activity with maybe minors and other persons and expose them. It can result in getting a higher or harsher punishment. Now, when it comes to proof, obviously different factors will have to be taken into account because you could bring the person court and they say, oh, it's not me. Oh, she cheat, he cheats. They get it from somebody else. So obviously, evidence will have to be presented in court. So whether it's medical documents and so forth, will take court if the person doesn't confess. Because in criminal law, a lot of people is really go to court and confess. They usually say not guilty to hopefully find some loophole to get off the offense, and sometimes usually lawyers, including myself, might advise them, let the prosecution prove their case. If I'm representing the defense, you have to prove your case. So if you think that this person gave this person HIV, then bring the evidence, find the evidence. Maybe you need to bring, maybe the fact who's their doctor, or maybe who they be to, and see if maybe the court might want to call that witness in and so forth. You think about SPGs, they don't have explicit privacy law in the country, so that's an issue. But well, I don't know.
The question was asked, how does mediation fall in this?
Well, mediation is basically usually an out-of-court process whereby the people come together and talk out the issue and try to come to a resolution.
Yeah.
So I guess it depends on the individuals and what you're looking for, because if by chance I trusted you as my whatever and you give me HIV or whatever, or vice versa, what are you looking for from the mediation? Are you looking for money? Are you looking for an apology because you're the virus?
And just
So it really depends on what you're looking for.
And also, you have to make sure the sperm that is received, because you have to get sperm to find out all of that.
Yeah.
And that person may not show HIV positive at the same time,
Because they could be
especially
unprotectable.
if this sex would have happened within the window period, which means within that 3 months period may show a negative.
Yeah.
And then you have to go back for another test that might not even show a positive and may continue to show. So how do you determine that the HIV positive came from that person who you said would have sexually assaulted you and not from a previous partner you would have had sex with?
Yes.
I think that's what. That
So the evidence is put before the court,
Yeah.
and a decision made. So different things may need to come out and test and
Yeah.
evidence and
Mhm.
proof to show. So it's a complex situation.
I think what we are seeing here is what I stated earlier.
Mhm.
Have a test with your partner, go do the test with your partner, go back to your, go get your result, take your time with your partner, and sometimes if it's so need to have sex with your partner, use a condom, be very cautious, use precautionary measures if you're doing
Yes.
oral sex and or
Use an oral dam.
Yeah.
right? Do these things in that lead up, and then you could do another. And I always
Do a test every 6 months or
and I
yeah,
always
preferably
believe that
every 6 months. Yeah.
even though you're in a monogamous relationship with someone, as Winfield said, that you might feel that your partner and your partner might be, you alone, but just for peace of mind, it don't change anything for the relationship. Mean that the love is less or the love is more. Just have,
Yeah.
I think one of the things when they get married, one of the recommendations is to go to an STD test. So they impose something in your marriage, knowing that this is what
And the trust. Yeah.
trust. So nothing wrong with nothing wrong until you your evening marriage that you can go on to a test, whether it's once a year or every 6 months. It's still something that you can do and build trust because when you're doing it every 6 months, you and your partner say, a man holding it down for me, a woman holding it down for me, whether the person is promiscuous or not, but they are protecting themselves inside because they are protecting me, who is inside with them.
I just want to add two things because Winfield, I think, mentioned it. Because we've been talking about getting tested and taking a partner to get tested, but people can be undetectable.
Yeah.
So you can go get tested, people also lie to you, say they're HIV negative, they really have HIV, but they're just undetectable.
Because there's no cure.
They're undetectable. So even if you and somebody go to get tested and they show up negative, that doesn't mean they don't have HIV. It's just undetectable because they probably are the treatment and they're taking care of themselves, health-wise and so forth. So some persons might feel justified in lying because, it's not actually showing up on the test.
Yes.
And also, sorry, just one more point. Also, when it comes to criminalization and court stuff in SPG, the thing is people not coming forward. People not going to the police and maybe even if they go to the police, how many cases go to court?
Yeah.
How many people actually get convicted for intentionally, knowingly and intentionally transmitting or infecting somebody with HIV? So as incidents and grenades, when people have HIV, because there's still a lot of stigma attached. People might not want to go to the police and much less go to court. Eyewitness news might be in court. One news might be in court, So sometimes when it comes to sexual stuff, sometimes the court doesn't allow certain individuals they make it for private.
Yeah.
But people are, people are afraid of the business being out there. Maybe the doctor don't know what he knows, but then the whole siblings know because I know there was this case. I know it didn't have to do specifically with dealing with somebody who transmitted the virus, but then I think it was a gay guy said that the pastor infected him and he ended up killing the pastor.
Yes.
And that was a big thing in SPG, but I don't think the pastor there, so nobody can be prosecuted, but allegedly he said the pastor infected with HIV. So, but you don't really see the cases. I'm not even sure if we have case law from Sydney itself of any actual convictions in terms of intentional transmission of HIV.
Yeah, but also, even if a person who's undetectable and is doing a test, it will always show up as a positive test, regardless of what.
Okay.
Yes, it still shows up as a positive test.
Oh, okay.
Because there's no cure for HIV. So it will always show up positive, but it will say undetectable, virally suppressed.
So we have so when they did the test in St. Vincent, it says positive but undetectable?
Yes.
Yeah.
Oh.
Because your HIV positive cell.
And the viral load as well.
It's very, and the viral load is very low. The copious copy is like 0.1, isn't it?
Well, I could add to that.
He wants to add to it.
Well, if they have the viral infection and they've had it for more than 3 months, there would be an antibody generation. The body will generate antibodies. So
Yes.
it's able to detect the antibody, but you may not be able to detect the virus. So if it's able to detect the virus, the antibody, it will be positive, but undetectable.
Yes.
Right.
Yeah.
Thank you.
Of course, the antibody is protection, so that is not transmittable. Right. But the virus is actually low.
Until they find a cure, then it will show up as a negative video.
Yeah.
We getting somewhere. We are understanding, what is, the population of HIV in St. the types of population in St. Vincent, well, key populations in St. Vincent. Went on to look at age of consent. We looked at the treatments. We even went on to talk about promiscuity with, our sexual behavior and how we could protect ourselves. Now, in all of this, one of the things that we know, we talked a bit about it when we started, but we want to dive a little bit more about it, is the discrimination of two persons living with HIV/AIDS. Now, there have been, we say now that there's been a significant decrease in discrimination against persons living with HIV/AIDS. But based on your mandate or your work that you do, can we truly say that persons with HIV/AIDS still experience a lot of discrimination in SCG? Or any form of discrimination in SCG?
There have been quite some form of that in terms of within the workplace, even though we have a workplace policy that was never really put to use. Because what may happen, like for example, when you went to work for Bank of SNG, you must do an HIV test as well. But you may start to work in a, yes, I understand, I'm sure I thought that with Bank of St. Vincent, that's one of the, allegedly that. But for example, you may get a job in a restaurant and somebody know you're HIV positive. Yeah, you got the job and there was no problem at all, but a friend sees you working there and then the friend will go and tell somebody who tells the employer that that person is HIV positive. Then the employer now wants, before you got the job, there was never anything for you to do a test. But now you get the job, you must go to do that test. How do we deal with that? Because normally, I always say that you never ask for disclosure. That person is not allowed to disclose their status for you because you never asked for that. And let us say that person's go to get a test done. The test comes back to be positive, but you decided you don't want the person to cook anymore. You will put them to wash dishes. That is discrimination. Because at the end of the day, you can't get virus from the person with HIV positive doing the cooking. And I am doing these sessions with about 4 or 5 cruise ships where I am talking to management of these cruise ships. Because on a cruise ship, if you're infected while on the cruise ship, you still have your job. But if you you're now going on the cruise ship and you're found positive, they will not take you, employ you. And when they find out you're HIV, they want to move you sometimes to the lower end of the job. And I said to them, that's discriminating against the person. Because we all now know how one gets HIV. So if you move the person from folding sheets and you're not putting the person to clean the deck. Who said if the person was cleaning sheep and now on the deck? Where is that person spreading the virus unless he or she gets in contact without a condom, naked? That's only how the virus will spread. So discrimination not only comes from, it can also come from within the workplace where you move from one place to the next and putting you at a lower area to work. Yeah.
And also, don't forget the workplace.
Well, I want to say that, and I can speak to it when it comes to the workplace, that there are certain establishments here in St. Vincent and Grenadines. They have workplace policies on HIV/AIDS and occupational safety and health, which gives a wider platform for organizations to address any health issue or safety issue. It could be communicable or uncommunicable diseases. And these workplace policies are guided by the ILO Convention 200, International Labour Organization Convention 200, which is a recommendation that speaks to how the workplace or the world of work manages HIV and AIDS. So it speaks to non-discrimination, care and treatment, equal opportunities for workers, and just having that decreased stigma. Now, if we have to categorize, I remember when we started off here in St. Vincent with the workplace policies and bringing awareness and building awareness at the workplace level, how uncomfortable some employers and their employees were because they see that the stigma was so much then. That was in 2005. It was so high that persons who are HIV positive didn't want anybody to know. And sometimes they suffered and died in silence.
Yes.
Because they didn't get the support. And there are times when they would have been ill and not able to come to work as, often, be present at work, and they will be, pulled out to say, well, like you abandon your job or you're not fit to carry out your duty. But with the advancement of care and treatment, these things are so much better. You're not seeing now where persons from before would have like the open sores and, the cough. Okay, like the cough or that to spread tuberculosis, so to speak, because these diseases are more contagious than even just having the HIV virus. So now we have in St. Vincent the Occupational Safety and Health Act. So there has been legislative reform and there's been the acceptance of workplaces or employers corporate responsibility, where we see employers showing more care and promoting, even having their own wellness programs at their workplaces. There are health clubs, they have some of them have exercise or fitness programs, or they have group discounts where they have gym membership, or they may have like a medical doctor assigned to that organization. So we have made progress, even though we are still dealing with discrimination. And there are a number of factors that would contribute to that. Even though we continue the education, we continue the awareness, the personal fear would cripple you. It will cripple your response. Wondering how you would manage HIV infection, and not knowing all that comes with it, the mental stress and all of that. We have to be mindful that it's not an easy struggle for somebody who has an illness, whether chronic or maybe HIV, to function in a normal space as the workplace. So I would urge persons to be a little bit more considerate. Sometimes, I think that we can walk in somebody else's shoe. Get a feeling to understand that, listen, they might have have been irresponsible, they might have not been as cautious, but the fact is, that is their current reality.
Yeah.
And they are trying to cope and trying to live with it. And sometimes our behavior and our actions to persons infected with HIV and other chronic illness can add to their detriment, and it can also put them in a state where they become, for want of a better word, spiteful. So it's a sensitive topic, and we will continue to move forward despite. I'm hoping for the best.
I just want to take a time right now to ask Joshua, when you talk about discrimination, what laws are in place to protect persons from discrimination in SDG?
Thanks, Makini. So, as Phyllis has highlighted, there are policies that various organizations or workplaces might have. There's the International Labour Organization Convention. There might be other treaties. When they talk about the different rights in those treaties, they might talk about protection for HIV/AIDS, or personal health status. But in SPG, supreme law is the Constitution, and there is no explicit protection from discrimination based on HIV status in our Constitution, in the non-discrimination provision. So that's the first thing. It doesn't even say health status, and that usually involves discrimination from the state or state actors. And also, when we look at just general anti-discrimination laws in SPG, we don't have a comprehensive anti-discrimination legislation, and also we don't have any explicit laws that protect persons from HIV/AIDS, from discrimination based on HIV/AIDS in SPG. For instance, in employment, if we look under the Protection of Employment Act, you can't see anything explicitly saying you can't fire somebody because they have HIV. So we have a lot of gaps here in the country where we have no laws that explicitly protect persons from discrimination. But in practice, you have policies, you have the different conventions that you can look to, and so forth, that might be able to offer some guidance when it comes to dealing with discrimination.
I want to ask for the persons here and the persons who are listening online, what are some of the policies and the conventions that you can look to, to help you in a case of if you're HIV positive or AIDS positive and you're being discriminated in your workplace, what policies or conventions you can go to for that kind of support?
Well, I think Phyllis already mentioned the International Labour Organization Convention 200. However, when it comes to policies, it's important to know that they might just be specific to that particular organization or department. For instance, a workplace, the specific company might have a policy surrounding HIV and discrimination, and also national policy. But per se, but it might not be like law.
Yeah.
And
policies
can change.
Yeah, they can change.
It's a guiding document.
Yes.
Yeah. So the ministries and the state might follow them, or the organization or company, but when it goes into court, then depending on how it was drafted and why and how high the authority is, then there can be some interpretation issues there, or the court might be able to use it. So it is a guideline.
Well,
it might not possibly be enforceable.
It's enforceable.
No, it depends on the policy.
The policy.
Yeah.
But we have a national policy on HIV and AIDS with regards to the workplace. There's
That
also
needs
one.
that needs to be
It
developed
needs
now.
to be updated.
That was how many years ago.
It needs to be updated and revised. I know of organizations who they have safety policies that includes HIV and AIDS and other illnesses. The Convention 200 under the ILO, however, is one that is universal and it applies to every country. And so you can go online, you can Google ILO Convention 200, and you read what it says. Our country, St. Vincent and the Grenadines, it applies to us. Every country in the world, it applies to. And it also gives guidance to that sustainable goals, we call it still, of non-discrimination and zero HIV infections. So there are some that may not, like for instance, in St. Vincent, while the law is silent in terms of having explicit law that speaks directly to HIV and AIDS, there are still the guidelines globally that would influence how we treat it.
Yes.
I asked a question because I want to dive into the fact that which creates the fear of persons. Is it okay for health providers such as nurses and doctors to disclose a person's HIV/AIDS status to others?
No. 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 So that is why when you are registered at the where you will go after you done your test and so forth, it is everything is used as code. There's no name. There's no name. There's no name. Oh, there's no name at all. So, so what may happen? No, the only person who will know, basically, the person with HIV will be the nurse at the infectious clinic and the doctor, more or less. And from the point of the health security unit, because you do the test and so forth and after the medication and they put back the powder. Other than that, they do not have that right. They don't even have the right to tell your boyfriend, your mother, your father. It is a big no.
We're going to wrap.
I was just going to try to tease out Winfield to say an exception. If the person is willfully spreading HIV to other persons,
but we don't know if he's if he or she is really doing that, and how do we know that person? If Joshua might just answer that, the legal man. I don't want to answer that.
We have one more question, but before that question, I just wanna ask this question to you guys. According to the Global AIDS 2024 report, funding for HIV programs in the Caribbean has increased by over 22% since 2021 through the Global Fund to fight AIDS, tuberculosis, and malaria. Have you seen the fruits of this bearing in institute?
But the funds have dwindled. It has dwindled drastically. I just came back from St. Lucia on Thursday from an OECS meeting that Global Fund is funding us. The funding has dwindled drastically. HIV has advanced. More so, it is now a chronic disease. It is now a chronic disease. Gone are the days when people were dropping down and dying from HIV. I remember when I was in Namibia, the only people in that African country was alive was persons over 60. Everybody else on the street was just, you walk in the street and just see people dying like that. Gone are those days. It's pre-medication and everything. As we spoke earlier on, the accessibility of getting those, the stigma and the discrimination is still a bit of a hindrance for that. And how do we measure all of that? That is measured by you're seeing people living longer, you're seeing people becoming more healthier, you're not seeing that many deaths, but you might see 1 and 2 new infections. Everything is out there. People reading, people learning, people doing better. People now having a lifestyle of wanting to live longer, wanting to look good. I have seen the fruits of that, and I can say that because I headed a lot of the HIV organizations around the Caribbean and Latin America. I have seen the fruits of it. I have seen where some countries now, and especially where we are almost reaching in 1990, that is set by UNAIDS, and I am happy that I am a part of what is happening for where HIV was to where HIV is at now. It is really a big turnaround. And St. Vincent thus far is doing an excellent job along with the other OECS countries and the Caribbean.
And not to take away from what you said, I'm in agreement. Regarding the funding, what I have noted, like before, when for even key population groups, you would have been able to give maybe more direct assistance to these key population groups, whether like maybe food basket, it may be like in different forms. But what I have noted now in terms of the funding, they are very specific, they specify exactly the use. And you have to follow those guidelines. So when people are saying, this group, you receive that amount of grants in order to do this for key population or LGBTQ community. These monies are specific. When I look at my contract, it says specifically key interventions, empowerment trainings, and they give you the thematic areas in which you must plan your programs and ensure that their desired outcomes are mirrored in the program that you're having nationally. So sometimes you see pastors get upset and they say, oh, there's no help for me, or these people are taking our money. It is not like that. So if you are given and they're saying that there's a need for St. Vincent, in St. Vincent and the Grenadines for more empowerment of key population groups, there is need for us to, ramp up treatment care. There is need for us to, expand our testing sites or, make it more wider. It means that that funding that comes to that particular ministry or stakeholder organization that are in line with the thematic areas for the funders, but they have to align the programs with it. You have to do specifically to tell you, listen, I'm going to give you funding for you to buy testing strips and so on. It is for that specific use. And then if you spend it wisely and there is an excess money that leaves back, you have to give it back if you don't use it. And sometimes it hurts to know that the very people that you are advocating for are making accusations to say that, oh, this person is stealing and you're depriving me of this and all, you get this money and you're not giving me. It is absurd. And I've heard recent expressions about such, and I want to caution you, pastors who want to go about and accuse organizations or even relevant authority of doing such things, to be mindful of what you're saying. Because in reality, the documentation is there. What comes down from the funders, it is there to guide the programs, and often these grants are not released all at once. It is released based on the progress,
of the work,
based on the reports, and the evidence that you are in line with the outcomes.
Because it can always cut.
It can be cut, it can be rejected. So be mindful, please.
Thank you so much, Phyllis. As a professional, I'm a project coordinator, and I could tell you this, like when I have to coordinate projects, it's very specific. You hardly get projects that give you space to do what you want. Top funders are very, and we a lot in the Caribbean, there are a lot of low-hanging fruits, right? But it's still specific. You don't get a project these days that's saying, for instance, if it's in HIV/AIDS, that's saying that it covers testing strips, it covers building a building or rehabilitating a building, giving persons who have HIV/AIDS grants, cash payouts, or giving them food supplies, or giving them medication. Sometimes you get 3 of that. You get 3 of that, and you might get 1 And sometimes people, and this is the anomaly that Wendy spoke about earlier, you have anomalies that try to manipulate the narrative of you get money, these organizations get money without understanding that yes, sometimes the organization does not do a good job on educating the grant, educating to the population, the type of grants and what's in the grant. But sometimes we also have the experience of persons coming to the organizations and you giving them this information, but the awareness of it not listening. They're not listening, they're doing everything but not listening. And then they end up and misinterpret information for their own individual reasons. But this is not about that. What we are trying to do today, which is what is the responsibility of Aurora, is to educate and bring awareness. And we want to make sure that after this panel discussion wraps up, that persons are a bit more knowledgeable of HIV/AIDS and symptoms and grenades and their social responsibility as persons who might have HIV/AIDS or know somebody who has HIV/AIDS or just to prevent themselves from getting HIV/AIDS. And I would like to wrap this up by asking the panel to give each of them, not long, very short, quick points on what they would like to see in symptoms and grenades as it relates to HIV/AIDS. Start with Wendy.
For me, get tested, know your status, have one faithful sexual partner, and know who your partner is. If you don't, if you can't, always walk with and use a condom.
A closing remark would be, your health is your responsibility. Sex sweet, but the AIDS thing is still there, and you as an individual need to take that responsibility and choose the right prevention methods that you're comfortable with, and to ensure
every time the private market
that you have one faithful partner.
Joshua?
Well, for me personally, I want to, advocate for two things. Based on our conversation here, we've heard, that we don't have explicit laws protecting persons, from HIV/AIDS. With HIV/AIDS in various circumstances such as employment and so forth. Those are not the policies and international conventions. We need local explicit laws here to protect persons, living or who have HIV/AIDS. Also, based on the conversation, we were talking about various medical treatments or care, and while we hear that there's PEP available, there isn't PrEP widely available. You might need to pay up money to get it. So hopefully, as
PrEP is available here, but by a private
yes, we need to pay a lot of money, more than likely to get. So hopefully it can be more accessible, maybe possibly even free in the future. Hopefully, we have the money so that persons, can protect themselves from HIV in this country. So those are just my two suggestions in terms of what I would like to see moving forward. We see better laws protecting persons with HIV/AIDS and more access to these various types of preventative treatment so that persons can better protect themselves so that even if they have sex, maybe HIV might be one worry on their mind. Yes.
Thank you so much, Hannah. Thank you, Whitfield. Thank you, Phyllis. Thank you, Joshua. I really appreciate it. I really appreciate your insights today. I really like the sauce.
Spicy too.
It was very spicy, and we know our population. We listen more when sauce is in it rather than just hearing person just talk. We like to hear the language that we like to receive, which is really good. That's one of the things that I think Aurora tries on is the fact that bringing conversation in a way that is digestible from any population. I would like to take this time again to remind us that we need to thank our sponsors, such as UNAIDS, World Health Organization, and Austria Foundation, because without them we wouldn't be able to host this particular panel discussion and Candlelight Vigil, which we're having right after this panel discussion. And I want to tell everybody to to remember it is our social responsibility to protect ourselves, protect our loved ones, and sometimes we might say, oh, I don't have to worry, but what you do can also affect your
Yes.
future generation.
Yes.
You know, it might not affect you, but it might affect your future generation. Don't be in a conversation and hear somebody say this spiteful. Or, you know, don't be in a conversation and be silent about, you know, if somebody talking about being, you know, having sex without condom and just
Yeah.
doing it as, you know, it's also your social responsibility as a community to say that it's not right.
Yes.
You know, whether, and if the person hates you for that, that was never your community.
Exactly.
Right? So I think we need to also understand, kind of go back to where the community raised us rather than we thinking we're raising ourselves. So I thank everyone in person and everyone online taking the time out to be part of Aurora SVG HIV/AIDS in St. Vincent Grenadines event, and I wish everyone here in person to get home safe. We have food treats for everyone. I get diet of water. But we have food treats at the back after the panel discussion, and everyone, yes, after the Candlelight Vigil, and everyone online, thank you so much for taking the time out to listen. I know I've seen the comments going up and up, so I know everyone is having, you know, a good time, just being informed, and we at Aurora SVG look forward to seeing you all in person and online on our next panel discussion. More information soon. Thank you.
Thank you everyone for coming. And we're seeing it already. What we're going to do is we're going to have our candlelight vigil. Hopefully it just takes us 10 minutes or less, whereby we just reflect upon those who have passed away due to HIV/AIDS here in SVG.
Just bring up the team.
So we have some candles here.
What the team for HIV for this year?
Those who want